Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about fibroids. If you are checking our previous videos, you would have remembered that we have done a short video on fibroid wherein it has investigation options. It has what sort of causes are there in fibroids, or what cause these fibroids, what are the treatment options. But since we are getting a lot of queries online and offline about fibroid topic, and also there are a lot of patients who are coming in for fibroids and asking a lot of doubts on it, and also the high success rate is making us do this video so that we can give you a better view of what we feel regarding fibroids. We are doing a series on fibroids wherein we are discussing about the causes in details, we are discussing about the fertility options in details, we are discussing about the pregnancy options on fibroids in detail. For someone suffering from fibroid, do check our series of fibroid topics so that you will know in detail if you're someone looking for something specific in this topic. So let's dive into the fibroid topic to know more about it. What are fibroids? Everyone knows fibroids are non-cancerous in nature. They are tumorous growths. So remember, everybody tells that fibroids are non-cancerous, but there are certain conditions where the fibroids can turn into cancerous tissues. Okay. So what are those conditions we will be discussing in the next topic. So as for now, what you have to remember is that fibroids are non-cancerous under certain conditions. Majority of them are non-cancerous. These are made up of muscle and fibrous tissue, and they can vary in size as well as in shape. It can start as a grain of rice. It can grow as much as big as a musk melon also. So this is fibroid. As you can see in the picture here, there are different types of fibroids depending upon the location, depending upon the shape, depending if they have a stalk or not, and how they are located. The pregnancy, the fertility, and all of these issues will come into place. So today what are we discussing here in fibroids topic is about the hormonal problem or the hormonal cause of fibroids. So why have we taken this topic first is because of our patients in patients, because many patients, especially suffering from fibroids, are either unmarried and in their early 20s, or are in their 35s or 40s. Okay. And both of the people, if we take an average, all of them, majority purpose, are suffering from this hormonal fluctuations. So we decided on conveying about hormonal fluctuation, how do these occur and where do these occur, and what are the side effects of this hormonal disruption. So let's dive into the topic to know about hormonal causes of fibroids. If you are someone who is suffering from hormonal disruption, then this video is for you. What are the signs and symptoms of fibroids? As you all know, the signs and symptoms of fibroids are very clear. First thing is menstrual irregularities or heavy menstruation. As you can see in the picture, heavy menstruation or prolonged menstruation. Some people just feel like, see, I just have 5 days of cycle or 5 days of menstruation. But remember, not the duration of the menstruation, but also the flow of the menstruation. That is, even if in 5 days you are usually using 2 or 3 pads per day, but that has increased going to 5 pads or 4 pads per day. That is also important. If there is a lot of clots that you're passing is also important, and also if it is prolonged also it is important, or if there is any irregularity, that is your cycle has decreased from 30 days to 20 days or 15 days, and every 15 days you're having this cycle, that is also very important. This is the common feature of fibroid. And then what is the other feature of fibroid is the pain during menstruation, dragging that kind of pain, bearing down kind of pain is also a common feature of fibroid. Pressure symptoms, if you're having pressure symptoms, especially in certain kind of fibroids, especially subserosal fibroids, they can cause pressure symptoms back, that is near the rectum, where you will have painful defecation, or on the urinary bladder. If it is in the anterior part, they can cause painful urination as well. Certain kinds of fibroids, if they are near the cervix region of the uterus, they can cause pain during intercourse as well. So, and then pressure symptoms you have already discussed, and then constipation. If you are having pressure on the rectum itself, you can have constipation as the problem also. And then if there is prolonged bleeding, what will happen? A lot of blood is going out, right? So if there is a lot of blood going, there will be iron deficiency anemia, there will be iron depletion in the body, there will be HB depletion in the body. That is also a common characteristic. If you are someone who doesn't know if you're having fibroids or not, do an analysis based on this symptom. Is there any change in the menstruation? Is it scanty? Is it very late? Then it can be because of PCOS, or it can be because of estrogen dominance, or if it is too much, and if it is too much of flow with too much of pain, and also menstrual irregularities, very frequently you are having menstruation, it can be because of fibroids, endometriosis, or bulky uterus. And also along with that, if you are having pale waxy skin, you just feel like you're getting fair, a lot fair every day, without a healthy glow on your face. If your eyes, eyelids also tell if you're pale or not. Your tongue is getting pale, you have lost that luster and that glow, that also means that you are anemic in nature. So if you are having any of these symptoms, you can evaluate yourself and get a doctor consultation as soon as possible. Apart from this, you might have reproductive as well as obstetrical problems, that is, depending upon the size of the fibroid, depending upon the location of the fibroid, there can be fertility issues, there can be pregnancy issues, there can be problem in conception, pregnancy, and there can be problem in retaining the baby as well. So that we will be discussing in the next topic. Now coming into the causes and the risk factors. So what are the main causes for the formation of fibroids are gene changes, hormones, ECM, that is extracellular matrix, and growth factors. Here we are going to discuss about hormonal problems only, because they constitute the majority of the fibroid problem. Coming to the hormonal disruption. Remember that females have different hormones like estrogen, they have progesterone, they have prolactin, they have FSH, which is follicular stimulating hormone, as well as they has luteinizing hormone, that is LH. So any disruption in these hormonal balance can lead to certain diseases. Okay, so today we are going to discuss about the disruption between the estrogen and the progesterone level. The estrogen and the progesterone level should be in a certain ratio. If this is the ratio, if this is estrogen and this is progesterone, if the estrogen is normal and the progesterone has gone low because of certain conditions, or the progesterone is normal and the estrogen has gone high because of certain conditions, that can lead into estrogen dominance, leading into fibroids. So what are the causes of this estrogen dominance? First, in the low progesterone level. If you are someone who is in your 40s or in your late 40s, then you are in the perimenopausal stage, which can be because of low progesterone level. So low progesterone level is one of the characteristic feature of perimenopausal stage. So that is physiological in nature. That can also lead into estrogen dominance, leading into prolonged periods. And then stress. So how is stress related to estrogen dominance or this hormonal disruption, as we are talking it so frequently, that stress is the main cause? Let me explain to you in very simple language. See, stress causes an increase in cortisol. Okay, cortisol, everybody knows about cortisol these days. It's all over the internet, it's all over Instagram. So you know that there is an increase in cortisol. It causes insulin resistance, a stage which is pre-diabetic in nature. And this insulin resistance can cause a decrease in progesterone or an increase in estrogen. So this cortisol hormone is causing increase in estrogen. Gut dysbiosis, this is something which is like least understood, but it has a lot of effect. See, your gut has certain bacteria and the gut metabolizes this estrogen. If there is certain problem in the gut, it can be because of a lot of antibiotic usage, you are destroying your good gut bacteria, or it can be because you are using a lot of proton pump inhibitors like pantoprazole, esomeprazole, rabdiprazole, and then you're destroying the lining, or you're destroying the absorption capability. This all can lead into gut dysbiosis, where the normal good bacteria is not there. So there is malfunction in metabolizing this estrogen, which can lead into estrogen excess. Next, coming into the excess body fat. See, how does excess body fat cause excess estrogen, thereby causing fibroids or PCOS or anything else? Remember that excess body fat is the main reason for estrogen predominance, especially in teenagers or in people who are unmarried or in their early 30s or in their late 20s. Why? If you're having a stressful life and if you're eating too much, the cortisol hormone will tend to make your body fatter by depositing the fat in the abdomen area, in the lower abdomen area, in your thighs and in your buttocks. Okay, and this fat has a capability of producing estrogen. Okay, estrogen is of two types, E1 and E2. It produces E1 type, which causes estrogen predominance. So fat is the main culprit behind this. Trans fat is a main culprit. Liver dysfunction, what is this? Has to do with the estrogen. Liver metabolizes this estrogen. Any problem in the liver can cause metabolic disorders in metabolizing the estrogen, leading into estrogen predominance, which is a very rare kind of thing. Lack of ovulation, if there is no ovum production, there is no ovulation at all, that can also cause increased estrogen. Or maintained level of estrogen with low progesterone. Okay, And then we have medication. This is very, very important. Here we have to stress about stress. That is, we have to have a deeper look into stress, gut dysbiosis, excess body fat, medication. These are the four main reasons why people are suffering from fibroids in this age or in an early age. Okay, what does medication have to do? People who have started their oral contraceptives at a very young age, that is in their teenage or in their early 20s, can have fibroids. And also, not only that, if you are using hormonal pills for your PCOD, that can also trigger fibroids in certain section of people. So if you are someone who is using oral contraceptives, without any doctor consultation, or if you are using hormonal medications, you have to be very cautious. Diet. What has diet to do with high estrogen level is that the consumption of meat, red meat, which includes mutton, lamb, pork and beef. If you are eating any forms of these kind of meat, that can lead into hyperestrogenism. And if you're someone who is in plant-based diet, and if you're taking a lot of soy products which have phytoestrogens in them, that can also lead into fibroids. So if you are monitoring your diet which has less number of estrogen producing contents, that can decrease the chances of you having fibroids. Since we have already discussed that there is estrogen predominance, this is estrogen, either decrease in progesterone or increase in estrogen can cause estrogen predominance. And estrogen predominance, how does this create this fibroids? Remember that if you take this as the female reproductive system, this is the uterus, there is an underlying tissue inside it called as the endometrial tissue, right? So what does this estrogen do? Estrogen has a certain capability to increase this endometrial tissue and to make it stronger. And also progesterone also has the same kind of thing. But the thing here is that not only endometrium, the whole uterus or the whole body is very estrogen susceptible. So when there is increased estrogen, what happens is that the uterus can start having these small blobs, that is tumors, non-cancerous tumors, which are fibroids. It can grow anywhere. So these are developed under estrogen excess, and when they get into a certain shape and size, they can start producing their own estrogen and growing on their own without any external estrogen help. Okay, so what does this progesterone do then? This progesterone will counteract the estrogen. It will help in counteracting the estrogen so that these fibroids will not grow. But in certain section of people, even progesterone can cause an increase in fibroids. That is why when you consult a gynecologist and they are giving hormonal pills, it does not work for certain section of people, while it works for certain section of people. So estrogen will cause this fibroid tissue to develop, and this fibroid tissue will have certain susceptibility, that is certain attraction towards this estrogen. Even if there is very low amount of this estrogen also, they will be very susceptible, then they will start to grow. This is the basic thing that is happening in the body under estrogen dominance. Apart from the, what are the other symptoms of estrogen dominance? First one is irregular cycles. It can be PCOD, it can be fibroids, it can be endometriosis, it can be adenomyosis. All of these are caused by estrogen predominance. Heavy periods or no periods, which is a characteristic of fibroid, which is heavy period and no period in PCOD. Hormonal headaches. You might be having or experiencing bloating, anxiety, mood swings, which is very common in estrogen dominance or estrogen predominance, where you will be feeling very lethargic throughout the day. You will feel sleepy throughout the day, and at night you will not feel sleepy at all. There will be sleep disorders as well. And also you will be bloated. You will feel like even if you are eating a very small quantity of it can be rice or carbohydrates as such, you feel like you have put on a lot of weight, especially in the belly area, and you're feeling very, you feel that you've accumulated a lot of water, and also there is a lot of gas inside your digestive system. All of these are also symptoms of estrogen dominance. Apart from that, there is breast tenderness, and even though you're controlling your diet, there is resistance to weight loss. That is, body is tends to get weight gain, or it tends to become a little bit fluffier, but it tends to stop the weight loss program in the body even after diet or even after your exercise or your workouts. So there are certain dietary restrictions you need to maintain if you are under estrogen dominance. Now let us get into the treatment part, which everybody has been asking questions about. We have a number of patients coming from different sorts of countries, and also people who are calling us, where they are not having a certain idea as to why they are using this hormonal pills, why are the reason that they are being given hormonal pills, and what are their side effects. Today we are going to discuss why these hormonal pills work for certain section of people, and why their prolonged use is not good, and what are their side effects. If you are someone who is suffering from moderate kind of fibroids, if their fibroids are very small, and even if they are multiple, if their size is very small, then you need not have any sort of medication. That is what your gynecologist will say. But if you are there in certain size or certain moderate size, they can give you with GnRH medications. So how do these GnRH medications work? Remember, I told you fibroids grow under estrogen, but if you're cutting this estrogen, and certain section of fibroids grow under progesterone, if you're cutting this progesterone, what will happen? The fibroids will shrink. That is what this GnRH medications will do. They will help in shrinking the fibroids by creating a menopausal stage. What is menopausal stage? Very low levels of estrogen, very low levels of progesterone. Their levels as such are very low compared to your reproductive age. So what happens? There is menopausal stage occurring. But if you're someone who is planning for pregnancy, this cannot be used. If you're someone who is like, very young, we cannot give this medication. If you're someone who is prone to this hot flushes or this hormonal disruption changes like mood swings, hormonal headache, weight gain and all, these can cause temporary menopause-like symptoms. So by causing menopausal-like symptoms, you will have shrinking in the fibroids. But remember, as soon as you stop this GnRH medication, the fibroid can again start growing. And also, you cannot give this medication for a longer period of time, because by giving this medication for a longer period of time, you will have menopausal-like symptoms without even developing menopause, which can lead into side effects like you can have bone fragility. That is, you can easily break your bones. You can have hot flushes. You can have severe mood swings. You can have hair fall issues as well. And also, this cannot be continued for a longer period of time. So they have to stop it at a certain limit. And after that, they have to do a backup therapy which has estrogen and progesterone in them. And by that backup therapy, the fibroid can reoccur again. And in whom should we not do this GnRH medication? We cannot do this GnRH medication in very young children or very young teenagers, and also people who are planning for pregnancy. So this is about GnRH medication, and what are the other options we'll view in the next slide. Now coming into the NSAIDs, which are non-steroidal anti-inflammatory drugs. So what happens in this non-steroidal anti-inflammatory drugs? They are especially to reduce pain. So if you're having fibroid, you will have this bearing down sensation, as if something or someone is pulling down your uterus. You will have severe pain during menstruation. So all of this, to counteract, they will be giving you NSAIDs. So if you are using NSAIDs for a very short period of time, that's okay. But fibroid is a chronic condition, right? So you have to be using this on a longer run. What happens if you are using NSAIDs on a longer run? There is no treatment for the pain. You're just becoming numb for the pain, okay? And what is the cause behind it? That is fibroid. So it is not doing anything to the fibroid. It is just a painkiller. And if you're using painkiller for a longer period of time, they will be telling you to take it along with the proton pump inhibitors like pantoprazole or rabeprazole or esomeprazole, which can cause absorption problems, and also it can destroy the gut bacteria if you're using a lot of NSAIDs. So lot of gut dysbiosis can cause again estrogen dominance, leading into maintaining this fibroid because of usage of this NSAIDs. Next, coming into the very famous hormonal pills. Many people, if you're suffering from PCOD or if you're suffering from heavy bleeding or cysts, they will be giving you this hormonal pills. Everybody might have seen this hormonal pills. You have to take it every day at a certain period for a certain period of time. That is say 3 months or 6 months, whatever your gynecologist suggests. But remember, hormonal pills are synthetic in nature, first thing. Second thing, this hormonal pills I've already discussed, they contain majorly, either they are in combination with estrogen and progesterone, or they are only progesterone only pills. This progesterone can counteract the estrogen, that is why they are given, so that the fibroid will shrink. But in certain cases, if there is no proper counteraction, or this progesterone can also help the fibroid to grow. Instead of shrinking the fibroid can grow. And also, if it is shrinking, as soon as you stop the hormonal pills, again it can reoccur. So the reoccurrence chances are also very high. Why are they giving it? So that there is counteraction between the estrogen and progesterone, right? As soon as this hormonal pills are stopped, you can have intermenstrual bleeding, that is bleeding in between or spotting in between your actual period. And also it can cause a lot of prolonged periods, in certain section of people. It can not treat the condition but make it worse sometimes. Then why are we taking hormonal pills? What are the side effects of these hormonal pills? The side effects of these hormonal pills are weight gain. It can cause a lot of hair fall. It can cause a lot of mood swings. But in certain section of people, it is helpful if their bleeding is too much and it is unstoppable, and also the estrogen dominance is too much, then POP pills can have a lot of effect on the body to temporarily cut off that section where there is prolonged bleeding. So in certain section of people it can be helpful, but if you're using it for more than 2 months or 3 months, the side effects are sure, and also this is not the cure for your fibroids. Remember, as you stop it, again the fibroid will start to appear, and this can trigger fibroids elsewhere also. So please do take into consideration if you are using hormonal therapy. Now coming into the last one, which is tranexamic acid. Many people might have been using this. They tell me we are using some tablets which starts with T. We are not usually acquainted with the medication name. But remember, this tranexamic acid is usually to stop heavy bleeding. If you are someone who is losing a lot of blood, you don't have a lot of time, and you're not in a reachable place where we can contact you, or you can use certain medication, people will usually be giving you this tranexamic acid, where it will stop the bleeding in 2 to 3 days. But the problem with this is after you stop it, again it can reoccur, it can cause spotting, it can cause nausea, it can cause vomiting, and it cannot be used on a longer run. So that is the problem with the conventional form of treatment for fibroid problem. So if you're someone who is suffering from fibroids or having all of the symptoms that we have already told, and you're using this conventional form of treatment like most of our patients do and come to us, they ask us, see, we are using this for a longer period of time, we have the side effects of the medications, and also our problem is not properly solved. So they come to us with the hope that homeopathy will relieve it. Why are they hoping in this, and why are we having a success rate? We'll explain it to you. See, homeopathy is the safest form of medication. So there is no side effects. Even if you're treating the disease, there are no side effects attached to this medication. That is the first, best thing about homeopathy. And it is non-invasive. You don't have to put anything inside your body. There is fibroid shrinkage. There is shrinking of the fibroid. There is hormonal balance happening. There is estrogen dominance going down. There is progesterone and estrogen level being maintained, along with regulating of the menstrual cycle and preventing the recurrences without any side effects. What else do you want? See, we are having good number of cases which have good success rate in them, where the bleeding, where the menstrual problems are slowly going down, where the irregularities are slowly coming down, and also the fibroid size is shrinking. There is no reason for you to go for a hormonal change or a hormonal therapy for the side effects. They have certain side effects attached to it. Although the cause for giving them is good, the side effects are something which is very alarming, right? And also there is no cure for it in that area. So here we are offering you with cure, we are preventing your diseases, and also we are preventing so that it will not reoccur again. The medication will be given to you so that there is no reoccurrence also. So if you want to look for cure, if you want to look for an answer for your diseases, homeopathic treatment is the best option for fibroid. Now let us get into the precautions part. What sort of you can be using any sort of medication. It can be Ayurveda, it can be homeopathy, it can be allopathy, and you can be having certain side effects, or you're using homeopathy and you're doing good. But there are some things that you need to do, which is being precautionary. Why should you be having, or why should you have these precautions? Is that, see, the medications will work their way, but if you are again triggering that through your diet or through your lifestyle, there will not be a good prognosis. So what are the do's and don'ts in fibroids? First, we'll discuss about the do's. First thing, as I told you, stress is the main cause. Decrease your stress by doing yoga or by doing pranayama or by working out. Second thing, we have already discussed about the body fat. So try taking diet which has less number of trans fat in it, or it has good fats rather than the bad fats. Try avoiding the packaged food. Third thing, try eating diet which is rich in fruits, which is rich in fiber, which is rich in good amount of fats, and also high amount of protein, which is very, very important. And also try maintaining a regular diet and also regular workout. So this will help in managing stress. It will help in managing your dietary triggers for your fibroids, and also it will help in managing your sleep cycle. If you're working out properly, managing your stress, the sleep cycle also will improve, thereby improving your lifestyle, thereby improving your fibroid size. What are the don'ts? Opposite of whatever has been told. If you are someone who is suffering from fibroids or irregular menstruation, Do not eat red meat, which is mutton, which is lamb, which is pork and beef. Do not eat soy products which have phytoestrogen in them. Do not eat trans fat, that is highly packed foods like chips. It can be popcorn, it can be anything which is packed. Reduce the amount of salt, because salt can start having waterlogging condition, or it will pull the water inside your body, so that you will become very, you'll feel very hefty, you'll feel that you have gained a lot of weight. So try reducing your salt, maintain good health and good lifestyle. So these are certain do's and don'ts. Please do look after your dietary restriction, as that will, have a psychological impact on your brain. Good food will have good mood, and good mood will clear out the stress. Stress cleared out will have decrease in estrogen, which will clear out the fibroid. This is a cycle which you need to remember. What happens if you neglect? Many people will just neglect these fibroids, or just neglect these menstrual irregularities. Remember that if you neglect it, there is something going on in the body, right? And estrogen has a lot of other different changes in the body as well. So the body, it can be fibroid, it can be endometriosis, it can be adenomyosis. You don't know what it is associated with. Sometimes the fibroid is associated with endometrial hyperplasia, which is bulky uterus. Sometimes it is associated with endometriosis. Sometimes it is associated with adenomyosis. Sometimes it's associated with cysts as well. So you don't know what's happening actually in the body, and it can go to a stage where you cannot come back from it and you need surgery for it. If you can cure it with medication, why do you want to go to surgery? And sometimes it can become cancerous, and it can spread also. So it can go into a bad prognosis. If you're someone who's suffering from menstrual irregularities, or if you're someone who's in the starting stages of hormonal disruption, having stressful life, take investigations. If there is any disruption, please do have a doctor consultation. If you're someone who's suffering from hormonal disruption, or if you're suffering from fibroids, adenomyosis, endometriosis, or ovarian cyst, chocolate cyst, or PCOD, and you're looking for cure, Fidicus Homeopathy is the answer. Here we have two types of consultations. One is online consultation and offline consultation. In the online consultation, we are having audio option and as well as video option. If you're someone who's staying nearby us, you can come and contact us in person. If you're someone who's staying far away from the nearest branch of Fidicus, you can contact us through online consultation. After the online consultation, we will be asking you for certain investigations regarding your symptoms, and if you have any sort of investigations already priorly done, you can share it with us. After the doctor consultation, especially to the online clients, our medication will be reaching your doorstep through courier. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. Across the globe, it can take 4 to 8 business days for our medicine to reach your doorstep. If you want to have a consultation, please do call us on this number, WhatsApp us, or message us through this number. If you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone suffering from fibroids, if you're seeing our video, remember that this video is done because of the lot of patient success rate that we're having, because we're doing this video for their queries itself. Many people are calling us just for for a lot of questions they have on fibroids, and then they're taking the appointments and then they're getting cured. So there is good success rate. So that is why if you're someone who's suffering from all of these diseases, especially female reproductive organ diseases, you have to choose Fidicus Homeopathy. Why should you choose Fidicus Homeopathy out of all the homeopathic doctors in the world? See, Fidicus Homeopathy stands for highest chance of health. Here we have three things. One is highest success rate, already curing things that are we are discussing here. Second is a transparent medication. There is no gray area between the patient and the doctor. Here we will be educating you on your prognosis. And the third thing, the personal care. The queries that you're doing or the queries that you're presenting, we are taking care of it, and we are answering this through our videos, so that majority of the people who are not able to reach us out are seeing this video and they are getting answers for their questions. So the personal care at Fidicus Homeopathy is top notch. If you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.